So let's get started. Good morning, everybody. Welcome to our webinar. My name is Olivia. I am the Senior Manager of Brand and Communications at Kontakt.io. So today we have a powerhouse duo joining us. We have Jim Hinton, a seasoned healthcare leader with over 38 years of industry experience. And Jim recently joined Kontakt.io's Healthcare Advisory Board. And on the other hand, we have Philipp, the CEO and co-founder of Kontakt.io. So today they're going to take us on a deep dive into the critical topic of healthcare operations, why operational transformation is a top priority for healthcare right now, and how to strike a balance between operational excellence and patient experience. So if you guys have any questions, please enter them into the Q&A box. We'll address them all together at the end of the conversation. So with that, please take it from here, Philipp.
Thank you, Olivia, and hi, Jim. I think we've deliberately said we're going to skip the long, CV read and introduction of all kind of the accomplishments and contributions you've made to, to the healthcare community. But I do want to ask you one question when it comes to an introduction, though. How did you end up in healthcare, and why, after spanning careers over 40 years, are you still that passionate about and engaging in all sorts of a relationship with providers, with technology vendors like us, in kind of keep on going in that domain? So that's the introduction, and your chance to quickly tell your story, and then we'll jump right into some of the things we've been discussing offline and wanted to share with the broader community today as well.
Great. Well, first of all, thank you for including me in this. I've been looking forward to this time to have a conversation with you and share a few of my experiences that might be relevant to the audience that's listening. So my journey started with my belief that I was going to go to law school, and I have two older brothers who are both in healthcare, and they're on the clinical side, and I didn't at that point think I wanted to go into healthcare. Applied to go to law school and was ready to go, and I had a chance encounter with an administrator in a hospital who asked me what I was going to do, and I said, I remember this like it was yesterday, Mr. Johnson, I think I'm going to go to law school. And he said, why the heck would you want to go to law school? And one thing led to another, and I ended up going to graduate school in healthcare administration, and that was really one of the key pivots in my life. They got me into healthcare. So, almost 40 years later now, I've had the privilege of being in what I think is the most important industry in the world. And, if without healthy citizens and without a high performing healthcare system, we're just not going to be able to reach our potential as individuals and as a society. So my mission is to make healthcare better. And what that does is it brings me right back to Kontakt.io. And one of my reasons for excitement of joining the advisory board, spending time with you talking about the evolution of the company, is I believe that Kontakt.io is one of those companies that is trying to make healthcare better, improving how healthcare works, and saving money for hospitals and health systems that are under a lot of stress.
So let's dive right into that. You said hospitals being under a lot of stress. I think in the quick 10 minutes we had prior to the webinar, said, what was your last kind of engagement with the executives of other health systems? I think you've mentioned you've just returned from a 3-day trip to Dallas. So give us the high-level summary. What are the top 1, 2, 3 talking points that every health system executive is currently concerned about? Kind of,
Sure, and I'm gonna share them as if they're separate, but they really all.
It's all part of the same. Yeah.
You can't solve one of them independent of the other. Well, I think the workforce issues are changing in their complexion, and there's some nuances to them. I do believe that the workforce issues continue to loom large, and that in the various conversations I had that was certainly something that was discussed. And we can go deeper on that if you'd like to. The second one that relates to that is finance, and hospitals are really being hit from so many different angles on financial issues, with uncertainty around reimbursement, uncertainty around their ability as health systems to more rapidly move from being inpatient focused to being outpatient and digitally focused. And related to that, how do you with capital being finite, the capital that a hospital has to spend, where do you make your investments and why? And so there's all of that. And then the third bucket is, boy, healthcare consumers are not real happy these days. Their prices are going up, whether it's through their employer plans or individual plans or their Medicare supplement plans. For states who have a big bet in Medicaid, those costs are going up. And so the people who buy healthcare, whether it's organizations, governments, or individuals, are all really stressed as well. So just to kind of circle back, I think it's workforce, finance, and kind of resetting that contract with patients and consumers of healthcare.
Understand. And if you think, throughout your own kind of, career as a health system CEO, how have these challenges evolved over the last, 4, 5, 6 years? Like, isn't that hasn't, workforce and finance and, happy consumers always been a problem? Or what is the new dynamic?
Sure. Well, I think one of the things that I really would like to do a webinar or talk to anybody without bringing up COVID, but you just can't do it because it impacts where we are so profoundly. And for hospitals and physicians, prior to COVID, all of these issues were there, but they have jumped up in magnitude fivefold. And just the assault on the workforce that occurred during COVID, and we all remember this, that healthcare workers went from being heroes to being villains. We were the ones that wouldn't let families into patient rooms because of the concern about COVID and spreading COVID. And so healthcare workers are struggling with their professional identity, and is this still a revered profession called clinical work? Doctors, nurses, other allied health professionals. And so people who can exit the workforce, who have the wherewithal to do that, are making other choices. And so the supply of clinicians is down, and it varies by specialty, but some specialties are just not seeing the interest of young people to go into them. So there's this looming cloud on the horizon of how is this all going to work out? And then financially, the move to outpatient, that has accelerated because we tried to keep people out of hospitals during COVID, and it put even more focus on the non-hospital approaches to care. So I think COVID was the villain that has put us into this situation that we're in today. And I don't want to talk about it. You may not want to talk about it.
No, let's not talk about it today.
Yeah, let's not talk about it anymore. But I do think that's one of the issues.
It's sufficient. So, doing a more kind of provocative question to you, and it's kind of, also your personal opinion, but what do you think must change in 2024, 2025 and beyond, if we think of the next 1 to 3 years, that hospitals and health system leaders can do that's within their power to address some of these changing dynamics, because COVID doesn't go away. Yeah, we can blame, policy making and reimbursement, and there's obviously, much bigger wheels. But what's in the control of the executive teams of these health systems that allows them to combat and counter address some of these pressing issues? And in our case, right, specifically in workforce and finance, because those are the two topics that obviously, Kontakt.io as a technology vendor is touching.
Sure. Well, I think it's like a lot of things in life. It kind of boils down to how you spend your time and how you spend your money. And if you're an executive in a health system, I think the question you ought to be asking yourself every day when you come in is, how am I spending my time and how am I spending the money of the health system that I'm entrusted with? And as it relates to time, I do think the role of the health system leader has been really broken into their external role with policymakers and others, so that people understand the pressures in health systems. But then internally making genuine, relatable connections to the workforce, and spending their time out talking to people, understanding their lived experience in these health systems. And that will allow them to do the second thing, how they spend their money. And I believe that the bias here has to be on technology first solutions, not bricks and mortar solutions. It's technology first. And
what do you mean by that? If you say bricks, mortars versus technology first, like what's your definition of that?
Well, there's some markets, including where I was a few days ago in Dallas, where the population growth is so profound that health systems do need to spend money on hospitals, because they have to get into markets that are growing. But in most communities, there are a sufficient number of beds, and so the question is, how do you optimize the productive capacity of those hospital beds, those hospital units, and the hospital in total, to get more productivity out of those existing assets? And again, it sounds, I don't mean to be patronizing to Kontakt.io, but your business, your product is right in the sweet spot of that. And a lot of the things that the company does, really were not very high on the priority list back in the good old days of hospitals, when you didn't have to focus on these things. Now you don't have a choice.
Yeah. I mean, now you've stolen my question, because I was just about to ask, what you've given sort of the answer on, because what we see right now, I'm kind of, changing the perspective, is we have seen such an uptick in demand that comes from, the genuine belief and interest of, we want to change our operations, the type of, underlying technology that we provide our total solutions based on, right, which is making health systems and hospital buildings kind of location aware, trying to understand how both patients and staff and assets are like flowing throughout space. That technology in itself, right, despite kind of evolution in cloud and new chipsets and AI, is not new. I think in our very first engagement, you've said, oh, RTLS, yeah, heard about it, was never, right, like a priority. Yeah. And what we see right now is, at least in the first time in this industry, when it comes to the healthcare and US acute care, and specifically, is we see wide enterprise adoption, which is not just here and there, but no, we want this everywhere, and we want it fast, and we're going to pay you more if you can do it faster. And fast means I want it in all 100 hospitals, and all 150 hospitals in less than 9 months, which is obviously being, a vendor in that space, like exciting because driving impact at high velocity is kind of what everyone wishes for. But I do think, the underlying shift that we are observing and that we see these leading health systems now kind of implement, explaining back to us, because that's how we can realize a first day ROI that immediately allows us to defer CapEx spendings that were lined up, to reduce rental equipment and OpEx costs, to further improve, right, productivity and efficiency for both nurses and caregivers, but also, the back office and the supportive type of function in a hospital. And now it kind of all comes together, and it almost marries these two topics of workforce and finance in a non-complex way. Yeah, we're not talking about integrating a new, EHR system, and you got to spend, $50 million. It's going to take you 4 years. No, there's a problem. There are solutions to these type of problems, and you can get started and then kind of expand from there.
So Philip, I think,
yeah.
One of the things to keep in mind is that, big health systems historically have had a tendency to be somewhat risk averse in terms of their investments. It's not true with all of them. These are all generalizations, and these health systems are all very different, as you know, based upon their sponsorship and their connections to the community and their mission and their clinical specialty orientation. So they're all somewhat different. But I would say that prior to COVID, there was a risk aversion. Well, why do we want to do that? Why do we want to rock the apple cart? Like, are we really going to put a little, RFID badge on our IV pumps? And what are people going to think? And all this stuff, right? Well, so what happened during COVID is all the risk aversion went away, because the shock to the system was so profound that it forced people to say, where can we invest to dramatically drive improved performance? And I think that's what you're experiencing when you're out selling the product is, hey, if we need to put a tag on our IV pumps or put a tag on the forehead of the nurses, we wouldn't do that, of course, but we tag everything. Let's figure out how to make it better for the nurses so they want to work in our hospitals. Let's make it better for the doctors so that when they are treating the patients, they have what they need at their fingertips. And let's make it better for the patients, because it's going to be more efficient. The patient or the nurses aren't in and out of the hospital room. Oh, we forgot that. Oh, that isn't here. What about that? I mean, it sounds silly, but these basics have become very glamorous in the new health system. And I think you're running a glamorous company now. It's in the right place at the right time.
No, exactly. And look, I want to touch based on sort of two topics you've just mentioned. Is Olivia, I think we said we don't want to show any slides, but maybe I want to show one slide, which is kind of the nurse, the nurse summary view, which in full transparency to the IP, is not a Kontakt.io slide. I've stolen it from Striker, which I think they used when they announced their acquisition of Vocera 2.5 or 3 years ago. No, one back. The 75%, the nurse, yeah, this one. And when I saw that slide, kind of it struck me because the quantitative summary is that 75% of nurse time is spent on administrative tasks, and 25% is patient contact. And then if you kind of on the right hand side deep dive into what is it actually that they spend time on, then obviously a big block, which is communication and documentation, than hunting and gathering, which is, I don't know who coined that term initially, but it's the idea of running around and looking for stuff that, captures up to 40 minutes per shift, up to 4 miles of, walking that's directly attributed to it. So I think anybody, either that's very close, that's within healthcare, and you talk to CNOs, this is not even getting better, it's getting worse. I think the conversation, I've had with the CNO most recently was due to post-COVID effects, even more of that back office kind of admin burden was put on nurses, because they're the only ones who were actually kind of on site. And so again, kind of zooming out, and I know this is maybe even more sort of in the CNO domain, but what is, from a C-level perspective, from a former health CEO perspective, the relevancy of that problem that we're kind of looking at in order to truly transform, how great healthcare is being delivered, tomorrow. Because again, don't want to talk about strikes and staffing ratios and all of that stuff, but I feel there's something wrong here that needs to be fundamentally kind of addressed.
Well, we know that most Americans don't get enough exercise. So you look at that and you say, well, at least these nurses are getting their steps in every day and can close the ring on their Apple Watch. But that's not where they want to be walking. Then that's not how they want to be spending their time when they're in a clinical setting. And so again, this is a problem that has existed for a very long time in healthcare. I think that the post-COVID effects are true. I would add to what was shared with you is that beyond whatever additional administrative burdens are being put on nurses, the clinical acuity of the patients we treat in hospitals has never been higher. And so when nurses are at the bedside, they need to have the supplies and equipment to do their job. And they can't be walking out of these rooms and spreading infections and other things like that. So this is no longer a nice to have, it's a must have. And just a quick story is my daughter's a nurse, and my daughter is very outspoken, especially with her father. And so when she would come off of the shift and she didn't have what she needed, I just got an earful. And I've kind of lived with this problem in a very personal way through my daughter. And it's like the pilot, not getting on the plane ready to push back, and the baggage door's open, and he's got to climb out of the plane and go down the stairs and close the baggage door before you can leave the flight. And so these are serious issues. And again, I think the systems that have figured this out are going to attract and retain clinical professionals at a rate greater than those who haven't.
Yeah, interesting. Amazing. Last question, Jim, before we can open up to maybe 1 or 2 questions from the audience. I think we have a lot of listeners on the call, or that will watch the recording later on, that work in a health system, either in a leadership position or aspiring leaders from a variety of functions within IT, within security, within clinical engineering. Question to you: how do I build a compelling business case for any type of investment into technology, right, in my health system today? What are kind of all of your mentoring kind of lessons that you say that's how you gotta play it, and this is what were the winning initiatives when I was in charge, and when I kind of see what's happening in the field?
So the CEO role, or any C-suite role in healthcare, is very challenging these days, and there are a lot of distractions, and there's a lot of people wanting something. I think the people that are most successful in advancing an investment thesis into the C-suite are those who understand what's going on in the hospitals, and they don't make claims about things that they don't really understand. So they're confident about what's going on in hospitals, and they make the assumption, which is a deeply held one of mine, is that regardless of the role in these health systems, finance, nursing, operations, human resources, the people in these roles, by and large, are extremely focused on what's best for the people we serve. And so I think taking that investment thesis and ultimately getting it down to the people we serve and how we can serve them better with a technology first solution, I think will go a long way.
Yep. Amazing. No other questions from my end. I'm getting the indication that we're almost out of time. Olivia, any questions from the audience that you feel you want to share?
Time we'll table the questions, and then everybody who attend this and register for this webinar will get the recording, and you also have a chance to have your questions addressed. So thank you, Philip and Jim. It's been a really wonderful discussion, and thank you all for joining us today. If you would like to see more information, please visit the Kontakt.io website or contact us to explore our solutions.